am the nurse Tutor Asia, and today we will be doing dosage calculations, and we're just going to keep it simple. So we're going to do oral dosages using medication labels. So let's get started. So the question says, a patient with an artificial heart valve has warfarin 7.5 mg's ordered. How many tabs would the nurse administer every day? And we're going to use the medication label that is on the screen. All right, so we look at the medication label, and it says that for every tablet, there is 2.5 mg's. So I'm going to start with what the physician has ordered, which is 7.5 mg. So it is important to know what our answer needs to end in. So our answer is going to end in tablets. So we know that mg's need to cancel out. So let's go back to our medication label, and it says that there is 2.5 mg's per one tablet. So mg's cancel out, and we're left with tablets. So we're going to multiply straight across and divide, and then we're going to get 3 tablets. The question says a patient is receiving omeprazole 40 mg's by the G-tube twice daily. The omeprazole is available in 20 mg per 10 ml solution. How many mLs will the nurse administer each dose? So we know that this question is asking for mLs, so I'm just going to write that to the side. So I like to start with the physician's order. So the physician's order is 40 milligrams. So we know that our answer needs to be in ml, so we need to cancel out our milligrams. So the problem says that the medication is available in 20 milligrams per 10 mLs. So we're going to cancel out our milligrams, and we're going to be left with mLs. So we're going to multiply straight across and then divide, and you should get 20 mLs. The question says phenobarbital 30 milligrams every 8 hours is ordered for a patient with a seizure disorder. The question says, how many mLs will the nurse administer with each dose? And we're going to use the medication label that is on the screen. So we know our answer needs to be in mLs, so we're just going to write that to the side just as a little reminder. And let's start with the physician order, which is 30 mg's. So we know our mg's need to cancel out, so let's go to our label. Now with this one, they try to be tricky with us, so they made it super small. So if you zoom in, you will see that it contains 20 milligrams of phenobarbital per 5 mLs. So we're going to write 20 on the bottom and 5 mLs on the top. So remember, in order to cancel out, you have to have like. So it has to be on the top and it has to be on the bottom. So our milligrams are going to cancel out. We're going to multiply straight across, then divide, and we should get 7.5 mLs. Ibuprofen 600 milligrams is ordered every 12 hours for a patient with rheumatoid arthritis. How many tablets would the nurse administer with each dose? So we know that our answer needs to be in tablets. So we're just going to write this down to the side just to remind us. Okay, so let's start with the physician's order. So the physician ordered 600 milligrams. So we know milligrams has to cancel out, so let's go to our label. Our label says that it is available in 400 milligrams per tablet. So we're going to multiply straight across and then divide, and then we're going to get 1.5 tablet. Is ordered Ristoril 0.03 grams by mouth at bedtime for sleep. How many capsules would the nurse administer with each dose? So this question is asking for capsules, so we're going to write capsules on to the side, okay? So let's start with the physician's order. So the physician ordered 0.03 grams. So let's go to our label. So our label is in milligrams. So what we're going to have to do before we can use the label is we need to convert. So grams has to go on the bottom. So we know that 1 gram is 1,000 milligrams. So grams cancel out and we're left with milligrams. So now we can use our medication label. So there says there's 15 grams per 1 capsule. So then we're just gonna multiply straight across, then divide, and you should get 2 tablets.